Let's discuss the extraordinary vessels, Wei Qi life cycles. Overflow qi that runs into the extraordinary vessels irrigates the space between the skin and muscle. As the space between skin and muscles is the space where the defensive qi circulates, protecting the body from invasion of external pathogenic factors, the extraordinary vessels play a role in the circulation of defensive qi. The extraordinary vessels circulate defensive qi over the thorax, abdomen, and back. This is a function which is performed especially by the penetrating, directing, and governing vessels. In fact, the governing vessel obviously influences defensive qi as it governs all yang energies and moreover controls all the yang channel in the back, which have a protective function. The penetrating vessel, being the C of the 12 channels, control all channels and in particular, all connecting channels which flow in the superficial layers of the body with the defensive qi. The extraordinary vessel's role in the circulation of defensive qi is another way in which these vessels integrate various types of qi which would otherwise not be integrated. The extraordinary vessels originate from the space between the kidneys and relate to the essence. And as we have seen, they irrigate the space between the skin and muscles where defensive qi circulates. Therefore, we can see that through the extraordinary vessels, the kidney essence play a role in the defense from exterior pathogenic factor in the space between the skin and muscles. Defensive qi is a yang type of qi, and as such, it is dependent on kidney yang. Although it is mainly the lung that diffuse defensive qi, this type of qi actually originates from the kidneys. Defensive qi originates from the essence and original qi and is transformed from kidney yang. Defensive qi has its root in the lower burner, the kidneys, and is nourished by the middle burner, the stomach and spleen, and it spreads outward in the upper burner, the lungs. Chapter 18 of the spiritual axis says nutritive qi comes out from the middle burner and the defensive qi comes out from the lower burner. Since the extraordinary vessel circulates defensive qi, which protects the body from the exterior pathogenic factors, they also play a role in the body's resistance to pathogenic factors. As all extraordinary vessels derive from the kidneys, this also explains the important role played by the kidneys in the resistance to pathogenic factors and the connection between the kidneys, the kidney essence, and defensive qi. The extraordinary vessels and defensive qi. So qi overflow into extraordinary vessels irrigating the space between the skin and muscles where defensive qi circulates. Extraordinary vessels circulate defensive qi in abdomen, chest, and back. And the extraordinary vessels play a role in protection from exterior pathogenic factors. Next, the extraordinary vessels and life cycles govern 7 and 8-year life cycles in women and men, respectively. Life cycles dependent on the extraordinary vessels storing of essence. Tiange Wei is a transformation of kidney essence through the agency of the extraordinary vessels. It is menstrual blood in women and sperm in men. The extraordinary vessels and the life cycles. The governing, directing, and penetrating vessels regulate the 7 and 8-year cycle of, respectively, women and men's lives. These life cycles are described in the simple question in chapter 1. This basically describes the ebb and flow of essence as the basis for sexual maturation and decline, and obviously corresponds to the hormonal life changes in Western medicine. For example, the simple question says that at 14 in a girl, the Tian Wei arrives, the directing vessel circulates well, the penetrating vessel is flourishing, she begins her periods, and she can therefore bear a child. At the age of 49, the directing vessel begins to become empty, the penetrating begins to decline, menstruation stops, and she cannot bear child any longer. Similarly, for men, Qiangwei refers to the precious essence that forms menstrual blood in women and sperm in men. This precious essence is a direct transformation of the kidney essence. Thus, the extraordinary vessel, and in particular the governing, directing, and penetrating vessel, are the vehicles through which the kidney essence is transformed into Qiangwei, which is responsible for sexual maturation and decline. Thank you for your attention.
Let's discuss the points of the yang Qiao Mai or yang stepping vessel. Opening point is bladder 62. Coupled point SI3, starting point bladder 62. Accumulation point bladder 59. Area of body influenced, lateral aspect of the leg, back, neck, head, eyes. The yang stepping vessel is the first line of defense in the system of reservoirs to absorb excesses of yang in the head. The yang stepping vessel is an offshoot of the bladder channel, and it brings yang energy up to the eyes. Its influence on the eyes and the muscle tone of the lateral side of the legs has already been mentioned when we discussed the yin stepping vessel. Although the yin and yang stepping vessels are somewhat symmetrical in their functions, there are some differences in their practical use. Whilst the yin stepping vessel's sphere of influence is mostly in the lower abdomen and genitals, apart from its action on the eyes, the yang stepping vessel's sphere of action is mostly in the head area. For this reason, it is used for windstroke, hemiplegia, aphasia, and facial paralysis. So to summarize the pathway of the yang stepping vessel, it originates inside the heel on the lateral side, goes to the external malleolus and bladder 62. It ascends on the lateral side of the leg and connects with bladder 61 and bladder 59. It ascends on the lateral side of the upper thigh and hip and connects with gallbladder 29. It goes to SI10, where it connects with the small intestine channel and the yang linking vessel. It rises outside the shoulder and connects with the large intestine channel at LI16 and with the large intestine and triple burner channels at LI15. It rises to stomach 9 and it connects with the large intestine and stomach channels and the directing vessel at stomach 4. It goes up to the stomach channel to stomach 3 and then rejoins the directing vessel at stomach 1. It then goes to the inner corner of the eye where it connects with the small intestine, bladder, and stomach channels and with the yin stepping vessel at bladder 1. From here, it continues over the skull, passes behind the ear, and enters GB20 where it ends. So these are the points of the yang stepping vessel. Bladder 62, bladder 61, bladder 59, GB29, SI10, LI15, LI16, stomach 9, stomach 4, stomach 3, stomach 1, and bladder 1. Thank you for your attention.
Let's discuss the Chong Mai penetrating vessel, the clinical significance of the 5 branches. The internal branch, the 2 most important aspects of this branch are that it arises inside the abdomen in between the kidneys and that it flows through the uterus. This means that the penetrating vessel is functionally related to the kidneys and the uterus very closely. For this reason, it is very important vessel in gynecological problems. Although the classics always says that this vessel flows through the uterus, it could be postulated that in men it flows through the prostate. Arising from the space between the kidneys, the penetrating vessel together with the governing and directing vessel determines the 7- and 8-year life cycle of women and men, respectively, and is closely involved in the transformation of the kidney essence into Qiangwei, that is menstrual blood in women and sperm in men. All the points of the penetrating vessel on the lower abdomen, which are on the kidney channel apart from stomach 30, therefore affects the kidneys and the uterus. Abdominal branch, The penetrating vessel flows through the kidney points on the abdomen up to kidney 21. It then disperses in the chest. The chest indicated in the ancient texts includes the breast. The pathology of rebellious chi of the penetrating vessel affects the abdominal branch of this vessel, causing a variety of different symptoms from the lower abdomen to the chest, breast, throat, and face. The abdominal branch of the penetrating vessel penetrates the membrane of the abdomen, and some of the symptoms of rebellious chi of the penetrating vessel are due to the tension and tightness of the membranes, fullness, distension, and pain of the abdomen. Next, the head branch. As it flows over the throat, rebellious chi of the penetrating vessel often causes a feeling of lump in the throat, which therefore is not always related to the liver chi stagnation. According to chapter 65 of the spiritual axis, the penetrating vessel brings chi and blood to the chin area, and in women losing some blood with menstruation. The penetrating vessel has a relatively less blood than chi in this area compared to men. The lack of blood in this area is the reason why women do not have a birth, as men have relatively more blood on the head branch in the penetrating vessel. This blood promotes the growth of hair in the face. Interestingly, facial hair increases after the menopause as due to the stoppage of the menses. This branch of the penetrating vessel has relatively more blood than before, and this promotes the growth of hair. The bird branch of the penetrating vessel is responsible for the contradictory feeling of heat of the face and rebellious chi of this vessel. Contradictory because it is associated with cold feet. Next, the spinal branch. The spinal branch of the penetrating vessel starts from the friend 1 and flows inside the lumbar spine. This branch accounts for the menstrual pain that is sometimes felt in the lower back. Next, the descending branch. The descending branch of the penetrating vessel flows from stomach 30 down the inner aspect of the leg to the internal malleolus and the foot. On the foot, it separates one branch joining the kidney channel, the other the liver channel, and ending at liver 3. The descending branch of the penetrating vessel is significant in practice for several reasons. Firstly, through the descending branch of the penetrating vessel, the kidneys bring yin chi down to the legs. The passage from chapter 38 of the spiritual axis quoted above is actually preceded by a question from the Yellow Emperor wondering why the yin leg channel flows from the feet to the abdomen and chest except for the kidney channel that descends. The answer clarifies that it is not the kidney channel but the descending branch of the penetrating vessel that descends. This implies that the penetrating vessel has the important function of ensuring the descending of yin to the legs. This means that it is the vessel to treat whenever there is a deficiency of yin in the leg, as for example, in restless leg syndromes. The descending branch of the penetrating vessel is therefore an important way in which kidney chi descends to the legs. Secondly, through its descending branch, the penetrating vessel influences all 3 yin channel of the leg, and it strengthens the interaction between the liver, spleen, and kidney channels. It is probably also because of the penetrating vessel that spleen 6 is a meeting point of the 3 yin channel of the leg. This means that a pathology of the penetrating vessel may affect the liver, spleen, and kidney channels on the leg. Vice versa, whenever we use the 3 yin channel of the leg, especially in combination, we are affecting the penetrating vessel as well. Therefore, penetrating vessel points such as kidney 11, kidney 12, kidney 13 affect the circulation of qi in the 3 yin channel of the leg. Thirdly, the descending branch of the penetrating vessel brings qi to the feet, warming them. Therefore, cold feet could be a pathology of the penetrating vessel that is its qi failing to descend. Fourthly, the descending branch of the penetrating vessel ends at liver 3. This means that this points up on the penetrating vessel. Every time we use liver 3, we are activating the penetrating vessel. It is also for its connection with the penetrating vessel, which is the sea of blood, that this point is such an important point to move blood in the uterus. Fifthly, it is probably because of the connection with the penetrating vessel and its integration of the 3 yin of the leg that spleen 6 affects the uterus and is effective in many gynecological conditions. Sixthly, fungal infection of the big toe may be a symptom of penetrating vessel pathology. Thank you for your attention.
Let's discuss the Chong Mai or penetrating vessel as the sea of 12 channels and sea of 5 yin and 5 yang organs. The penetrating vessel is also called the sea of the 12 channels. Chung has also the meaning of qi, streets, tong, activity, movement, xing, movement, and tong, free passage, all terms that refer to the flow of qi in the channels, which are compared to streets, avenues, or crossroads. Since it is both the sea of blood and sea of the 12 channels, the penetrating vessel influences movement of qi and blood in the whole body. Under the umbilicus is the motive force, and between the 2 kidneys, which governs human life and is the root of the 12 channels. This is the sea of blood of the penetrating vessel, the sea of the 5 yin and 6 yang organs, and of the 12 channels. It oozes into the yang, irrigates the essence. It is the motive force below the umbilicus and in the uterus. It moves upwards and downwards. It is the penetrating vessel. Hence, here, chung means tong, motive. It is the sea of the 12 channels also because it affects channels nearly all over the body, except the arms, and because it controls all the secondary channels over the abdomen and chest. Penetrating vessel is the sea of the 12 channels also because it controls all the blood-connecting channels. The concept of streets, avenues, or crossroads with regard to the penetrating vessel is worth exploring. In the chest, qi has streets. In the abdomen, qi has streets. In the head, qi has streets. In the lower legs, qi has streets. Therefore, if there is a problem with qi in the head, stop it at the brain. If there is a problem with qi in the chest, stop it at the front of the chest and at the back transporting points. If there is a problem with qi in the abdomen, stop it at the back transporting points and at the penetrating vessel on the right and left of the umbilicus, which is the moving qi or motive force. Tong qi. If there is a problem with qi in the lower legs, stop it at stomach 30, here called qi chair, and at bladder 57. From this passage, it is apparent that the penetrating vessel controls all the channels or streets of the abdomen and the alternative name of stomach 30. Avenues of qi is significant. In fact, the qi of the penetrating vessel emerges from the deep abdomen at this point, which has a powerful dynamic effect on the circulation of qi in the channels of the abdomen. Now let's summarize the penetrating vessel as sea of the 12 channels. It controls all channels of the abdomen, controls circulation of qi and blood in all channels except in the arms, controls all connecting channels. The penetrating vessel is the sea of the 5 yin and 6 yang organs because it is the extraordinary vessel at the center of the energetic vortex created by them. It is the father of the other extraordinary vessels. The penetrating vessel is the link between the pre-heaven qi, kidneys, and the post-heaven qi, stomach. So here is the vortex of the extraordinary vessels, and you can see the penetrating vessel, which is figuring prominently as the inner core. Due to its complex pathway, the penetrating vessel influences many organs directly. It is directly related to the 3 yin channels of the leg, kidneys, liver, spleen. It is closely connected to the stomach, emerging at stomach 30, and the heart. Therefore, it is related to the kidney, the pre-heaven qi, stomach, post-heaven qi, and the heart, the emperor, which are the 3 treasures of essence, qi, and mind. Now, let's summarize the penetrating vessel as the sea of the 5 yin and 6 yang organs. It is the root of pre-heaven qi through kidney connection and post-heaven qi through stomach connection, influences the 3 yin channels of the leg, liver, kidney, spleen, affects the heart at the center of energetic vortex of extraordinary vessels. Thank you for your attention.
Let's discuss the Chong Mai penetrating vessel, heart, and the stomach. The penetrating vessel has a deep influence on the heart as it flows around the heart. Indeed, in the various passages quoted above mentioning the great connecting channel of the kidneys in connection with the descending branch of the penetrating vessel, the Chinese expression is actually the great connecting channel of the lesser yin, and some authors think it might refer to a great connecting channel of the heart rather than of the kidneys. Heart is connected to the uterus via the uterus vessel. So there is a debate as to whether this uterus vessel is part of the penetrating vessel or whether it is a separate channel. So it rather tend to think the former. Heart chi and the heart blood descend towards the uterus, promoting the discharge of menstrual blood during the bleeding phase and discharge of the eggs during ovulation, which are under the control of the penetrating vessel. Apart from gynecology, the penetrating vessel influences the heart rhythm and can be used for arrhythmia. Next, the penetrating vessel and the stomach. The penetrating vessel emerges from the point stomach 30, which is the upper point of the sea of food. Therefore, the penetrating vessel is closely connected to the stomach via this point. The kidneys are the gate of the stomach. Hence, the penetrating vessel originating from the kidneys treats both. There are two clinical implications in the connection between the penetrating vessel and the stomach. Firstly, this vessel can be used for any stomach disorder, but particularly those of a full nature. For example, stagnation of qi in the stomach qi not descending, blood stasis in the stomach heat. The points to use are the opening and coupled points for the penetrating vessel, spleen 4 and PC6 plus kidney 21 and stomach 19. Secondly, the penetrating vessel affects the stomach channel's connection with the heart. The great connecting of the stomach is called Shu Li, and the beating of the heart in the left ventricle represents. From the Chinese point of view, the beating of Shu Li. This means that the stomach channel can be used to treat heart problems and particularly problems of arrhythmia. However, the stomach influences the heart also via the penetrating vessel, as this vessel connects with the stomach and heart. The relationship of the penetrating vessel with both the uterus and the stomach explains morning sickness in pregnancy. This is due to the rebellious qi in the penetrating vessel deriving from the profound changes taking place in the uterus in the first 3 months of pregnancy. In women who suffer very severe morning sickness and vomiting for longer than 3 months, there is usually a pre-existing condition of rebellious qi in the penetrating vessel. Due to the relationship between the stomach and the penetrating vessel, the Herban Wei Xia, which enters the stomach, is sometimes used to regulate the penetrating vessel. For example, this is the rationale for the inclusion in Bashua in the formula Wen Jing Tang, warming the menses decoction for the cold in the uterus. Thank you for your attention.
Let's now discuss the young Qiao Mai or young stepping vessel symptoms. The young Qiao Mai pathway. The young Qiao Mai begin at the point bladder 62, then it travels to bladder 61 and ascends to bladder 50. The channel then moves through the lateral aspect of the thigh to gallbladder 29. From here, it travels over the lateral aspect of the body to SI10. From SI10, the channel goes over the shoulder through LI15. LI16 ascends to stomach 4, passes stomach 3 and stomach 1 to bladder 1. At bladder 1, it connects with the yin Qiao Mai and proceeds over the head to gallbladder 20, where it ends. Now let's discuss the yang Qiao Mai functions. First, yang Qiao Mai brings qing body fluids and nutritive yin qi from the head down to the kidneys, and it receives its energies of the yin Qiao Mai. The yin Qiao Mai absorbs excess yang energy. Yang Qiao Mai absorbs excess wind from the head area. If the yang Qiao Mai has excess, the eyes are open and don't close, and there it is insomnia. If the yang Qiao Mai is deficient, the eyes are closed and unable to open, and there is hypersomnia. The yang Qiao Mai nourishes the hip. For the yang Qiao Mai symptoms, there will be rhinitis, stroke, sudden deafness, hypertonia, migraine, severe dizziness, sudden deafness, epilepsy, eye pain, low back pain, which is one-sided, lower leg pain along the gallbladder channel. Next, we have yang Qiao Mai palpation. So, palpation of the iliotibial tract along the gallbladder channel. In addition, check the hip rotations, and the balance between the external hip rotation and internal hip rotation points to an imbalance between yang Qiao Mai and the yin Qiao Mai. An example of this is sciatica, which is along the pathway of the gallbladder channel with pressure pain of the iliotibial tract points to yang Qiao Mai involvement. Here's an illustration of how to do the palpation. Yang Qiao Mai point pair. The confluent point is bladder 62 with the Dumai coupled point. The coupled point is SI3 with the Dumai, which is its confluent point. Now let's talk about yang Qiao Mai disease patterns. The following Sangfu diseases patterns can appear similar to yang Qiao Mai problem and have to be properly differentiated. First is wind heat in the lungs. Second is wind cold in the lungs, and third is liver wind. So let's discuss further. Wind heat in the lungs. The defense wei qi of the lungs is fighting against the invasion of wind and heat pathogenic factors. Wind heat in the lungs can be a reaction to wind cold in the lungs. Cardinal symptoms: acute cough with yellow sputum, aversion to wind and heat, infection with fever and sore throat. Wind cold in the lungs. The defensive or the wei qi of the lungs is fighting against the invasion of wind and cold pathogenic factors. Cardinal symptoms: acute cough with watery or white sputum, aversion to wind and cold, sneezing, feeling chilly, shivering, and shivering. Liver wind. Liver wind arises from extreme yin-yang and qi blood imbalance. Hyperactive liver blood deficiency, or heat may all in extreme cases steer liver wind. The symptoms vary according to the cause. Cardinal symptoms: hyperactive liver blood deficiency, or heat may all in extreme cases steer liver wind. The symptoms vary according to the cause. Among the cardinal symptoms are trembling, spasms, aversion to wind, sudden vertigo, and deviation of the tongue. Thank you for your attention.
Let's discuss the extraordinary vessels diagnosis. The 8 extraordinary vessels supplement the system of channels and sangfu. They have a strong relationship to the kidneys and serve as a reservoir for Jing essence. When the body is weak, the treatment of the extraordinary vessels can help the human organism to increase Jing and strengthens the body. The extraordinary vessels are able to absorb pathologies from the 12 channels. If a surplus of pathological factor is present in a channel, it can be transmitted to and absorbed by the extraordinary vessels and therefore help and protect the channels and the sangfu system. However, this transmission can cause the extraordinary vessels to be affected by the pathology. The 8 extraordinary vessels and their confluent points are the following. Mai, SI3, Yang Qiao Mai, bladder 62, Ren Mai, lung 7, Yin Qiao Mai, kidney 6, Chong Mai, spleen 4, Ying Wei Mai, PC 6, Dai Mai, GB 41, Yang Wei Mai, TB 5. Diagnosis. The correct diagnosis plays a central role when treating the extraordinary vessels. The difficulty is that symptoms pointing to the extraordinary vessels disharmonies overlap with symptoms pointing to disharmonies of the sangfu organs and vice versa. It is important to differentiate problems of the 8 extraordinary vessels from problems of the 12 channels. In clinical practice, palpatory diagnosis is used to verify and determine involvement and disharmonies of the extraordinary vessels. Pressure pain at areas corresponding to the extraordinary vessels can be used as a reliable sign of extraordinary vessels involvement. The presence of pressure pain shows a disharmony of the extraordinary vessel, and the vessel should be treated. Example, the pain palpation and spinous process of the vertebra is a sign of Mai disharmony. The confluent point of Mai, SI3, can be treated. If the patient complains about symptoms of vessel disharmony, then this information can serve as a further confirmation of the palpatory diagnosis and point to the treatment of the vessel. Example, a weak immune system due to lung qi deficiency and painful palpation on the spinous process of the vertebra is a clear indication for treatment of Mai. The Mai controls the yang aspect of the Jing. The treatment of Mai is very effective to boost the immune system in chronic lung qi deficiency. Palpation can be used to confirm the treatment. Necessary and correct treatment of the vessel immediately reduces the pressure pain on the spinous process of the vertebra. Next, the treatment. The following approach is useful for the treatment of the extraordinary vessels. First, palpate the corresponding body areas and note any pressure pain. The presence of pressure pain indicates the necessity of treatment of the vessel and gives information about the side of the body that should be treated. First, the side on which the corresponding body area was painful and palpation should be treated. When palpating Mai and Ren Mai, it is important to note if palpation results in a pain radiation on side or the other. When pain radiation on a certain side is present, then this side should be treated first. When no pain radiation is noted, that the practitioner can start treatment at either side. Treat the confluent point of the affected vessel. Third, check the associated body area for pain on palpation. If no more pain is present, then the treatment can be terminated. If the pain is just reduced but still present to some degree, then the confluent point can be treated again, or the coupled point can be treated. In addition, the treatment can be continued at the possible side of the body. Thank you for your attention.
Now let's discuss phlegm fluids in the lungs and liver fire insulting the lungs. Phlegm fluids in the lungs. Manifestations: cough with a low sound and expectoration of white watery dilute sputum, feeling of cold, feeling of oppression in the chest, tiredness, poor appetite, and low spirits. Tongue is pale, swollen, with a sticky white coating. Pulse is soggy. This is not a common pattern seen in chronic cough. It usually occurs only in the elderly. Treatment principle: drain dampness, resolve phlegm, scatter cold, tonify spleen and kidneys, and stop cough. Points: lung 5, lung 1, REN 12, REN 9, stomach 40, spleen 6, spleen 9, kidney 7, bladder 20, stomach 36, bladder 13, do 4, bladder 23, bladder 22. Reinforcing method and stomach 36, REN 12, bladder 20, do 4, and bladder 23. Reducing or even method on the others. Moxa is applicable. Do 4 and bladder 23 are reinforced with moxa if there is a kidney yang deficiency. Bladder 22 is reduced to promote the transformation of fluids and therefore resolve phlegm. Lung 5, lung 1, REN 12, REN 9, stomach 40, spleen 6, spleen 9, kidney 7, bladder 20, stomach 36, bladder 13. These points have been explained when we discussed the topic of damp phlegm. Then we go to liver fire insulting the lungs. Clinical manifestations: sudden bouts of cough, red face, often elicited by emotional stress, dry throat, feeling of phlegm in the throat, expectoration of scanty phlegm, hypochondrial distension and pain, pain on coughing, bitter taste, dark urine, dry stools, irritability, and dry mouth. Tongue is red with redder sides, dry yellow coating. Pulse wiry and rapid. This is not a common pattern seen in chronic cough. Treatment principle: clear the lungs, drain liver fire, restore descending of lung qi, stop cough. Points: liver 2, GB 34, LI 11, lung 5, lung 1, REN 17, GB 21, all needled with reducing or even method. Liver 2 drains liver fire. GB 34 pacifies the liver, eliminates stagnation from hypochondrial region and chest. LI 11 clears heat. Lung 5 and lung 1 clear lung heat and restore descending of lung qi. REN 17 subdues rebellious qi in the chest and restores descending of lung qi. GB 21 subdues rebellious qi and makes the qi descend. Thank you very much for your attention.